Hello, this is Kamran Bhopal again with another station, which is a skill station for circumcision. You've got a 23-year-old who has come in for a circumcision. What are the indications? So number one is pathological phimosis and recurrent paraphimosis, recurrent balanitis, BXO, which is lichen sclerosis, penile ulcers or cancer. Then you've got resistant genital warts. NICE does not comment on cultural circumcision, but that is one of the things that patients undergo circumcision for as well. What is phimosis? So phimosis is the inability to retract the foreskin. What are the types? Pathological and physiological. What is the difference between pathological and physiological phimosis? So physiological phimosis is usually present in children, has got a pouting appearance or carnation flower appearance on retraction. Whereas pathological phimosis is usually caused by BXO between ages of 40 and 60 years, no pouting and scarred white ring, although it can also be present in children. What leads to ability to retract foreskin in physiological phimosis? So epithelial desquamation, spontaneous erections, and penile growth. All of these three things leads to the ability to retract foreskin in physiological phimosis, which is normal for children. So what is BXO? So balanitis xerotica obliterans or lichen sclerosis is a chronic inflammatory condition of the foreskin which with increased risk of cancer. It is characterized by white spots and a fibrous ring which may cause phimosis. Treatment is with steroids and emollients, but if no adequate benefit, then circumcision is considered. What is the alternatives to circumcision? The alternatives are topical steroid cream such as Betnovate 0.1% twice daily for 6 to 8 weeks. It accelerates the release in about 70 to 80% of the people, but it is not effective in BXO. Sorry, it may be effective in BXO, but the other options are prepusoplasty and a dorsal slit, and these are ineffective in BXO. Contraindications of circumcisions are hypospadias, buried penis, local infection, and coagulopathy. And how would you consent for the procedure? You can look it up yourself. What is the equipment needed for circumcision? So minus tray, blade 10 for adults, blade 15 for children, gel-in-it gauze, bipolar diathermy, Vicryl Rapide, 3.0 for adults, 4.0 for children, bipolar scissors if available. They might ask you bipolar diathermy settings. So, your bipolar diathermy settings should be between 10 and 15 for coagulation. Why use bipolar diathermy? So, penile artery is an N artery and it can get thrombosed, which can lead to necrosis. So that's why you don't use monopolar. So thrombosis can occur because of monopolar diathermy. So henceforth you use bipolar, so the current passes through the tips of the two prongs of the bipolar, and henceforth doesn't cause penile artery embolization or thrombosis. How to perform a circumcision? You can have a look up yourself. Important things initially to mention is WHO checklist, no routine antibiotics, prep and drape, and then you can put clips to foreskin with gentle traction, mark the outer incision, then pull it back and mark the inner incision. If you can't pull it back, you do a dorsal slit and then pull it back and do an inner incision. Clean the glands from inside and then remove the skin in a sleeve pattern, and then use a 3.0 Vicryl Rapide to join the inner and the outer incision, and obviously hemostasis in between and gel-in-it dressing. How do you do a penile block? So, or how would you do a penile block? So, in adults, you can use 10 mils of 0.5% levobupivacaine and 10 mils of 1% lidocaine and mix them. And the way you do it is go at the base of the penile shaft and go all the way down perpendicularly till you hit the bone, and then come back up and aspirate and insert the local anesthetic, and about 10 mils of it is given like this, and then you can give the rest as a circumferential block through the same poke that you've done. However, written it here. So 20 mil syringe and a 23 gauge blue needle, palpate pubic symphysis, clean skin 1 centimeter below the pubic symphysis, needle through the skin and buccal fascia, feeling a pop, aspirate, infiltrate 10 mils, remaining 10 mils as a ring block around the base of the penis on each side. Aspirate again before any injections. All right. So how will you do the operation note? I'll let you think about it yourself. How will you follow these patients up? So no follow-up is usually required. I will write with the results of the histology if it is sent, and if there is something suspicious on the histology, I will arrange an urgent follow-up in the outpatients. So that's the station for circumcision, and we will see you with the next skill station, which is flexible